be discussing the women's pain gap today, but before I begin, just because this is the internet, I want to state I understand that men also have medical negative experiences, and nothing that I say in this video diminishes that fact. I have seen the women's pain gap discussed on and off periodically, but I don't think it gets discussed enough. And I seen a recent advert in relation to women's pain gap, and it was good that it is being talked about, but at the same time, in an advert setting, sometimes people can just turn off. And I do think this is something that few people fully understand what it is, where it comes from, and how in the real world it actually affects us. I wanted to start off just briefly by explaining what the women's pain gap is the widespread phenomena of women's pain being misunderstood, misdiagnosed, and mistreated in comparison to men, and the unconscious bias within the medical field. Now, although this does sound like something from the history books, unfortunately, it is alive and well today in 2025. But in order to figure out where it began and how it started, we do have to go further back into history. It's no secret that women were pretty much second-class citizens going back in history. We were told to sit down, shut up, don't complain. And unfortunately, that also led to a lot of the big, important jobs within medical science research being men-led, and, well, at least on the surface, men-led. So a lot of medical breakthroughs came from men themselves, and that meant that they chose who they done their research with or who they included within their research, and that led to the majority of medical breakthrough research being conducted solely on men. And what that means is within medical trials, only men were tested, only men's experiences, symptoms, recovery were considered within the trial. And that meant that all of the results that we've got from these medical breakthroughs all only represented male biological bodies and reactions. I want to include here that I am an advocate of the LGBTQ plus community, and I am going to be talking about biological sexes today. I am not talking about gender. I fully support trans individuals and the trans movement, and I don't want this to become a discussion point, negative discussion point down below. So this is not in order to offend anybody, but I'm simply talking about biological sex. So when we think about what that would result in, it results in all or the majority of medical intervention, treatment, illness, knowledge that we have today, all being based simply on just the one biological sex, which is men. When you add the history of labelling women hysterical for almost everything outside of sitting down, shutting up, and complying, then we get the being dismissed aspect of this situation. You might think that it's not that much of a problem because, yes, they used men, but we still got the breakthroughs, we still got the medicine, we still learned about the illnesses. But stating the obvious, from a biological standpoint, women's and men's bodies are not the same. Because of this, there are so many unknowns in female medicine that have never been addressed. When we look at things like pregnancy, periods, reproductive illnesses, hormone-related issues, just to name a few, it can become clear why so many women's issues, problems, illnesses are going undiagnosed, unseen, unheard. I know things like this, when they are talked about so abstract, can be difficult to understand. So I wanted to use a few real life situations, some of which I actually have experience of myself. The first thing I wanted to talk about is the coil. Now, the coil is something I've had personal experience with, so I will be able to discuss this, but there's also so many thousands of women who have shared their experiences online. And personally, I've had people talk to me about it, I've talked to them about it, and it is a hot topic at the moment because it is being discussed again in the media. Now, the coil is a T-shaped device that was designed probably by people who are never going to have to use it. And the way that the coil is described by mental health professionals and in the literature is a minimally invasive, minimal to no pain inserted device. And the advice that is given to women who are going to be getting the coil is just to take some paracetamol, some pain relief, half an hour before arriving. The procedure is nice and quick, and then you can leave, and you may need some additional pain relief after the fact. Again, paracetamol, some ibuprofen. The insertion of the coil is simple, however, it is also quite a horrific experience for many women, including myself. The coil is inserted into the uterus. Now, the uterus is a body part that is not designed to have anything inserted into it. That's not what its purpose is, and that is not the function of the uterus. However, it does work as birth control, and quite successful birth control as well, and it is helpful to many women. However, when inserting something into somewhere that is not intended to have something inserted into, it can be understandable that for many women, the pain is quite significant to often horrendous. Once it's been inserted, because it's initially like this, once it's inserted and pushed out, the little sides ping up like this to fill the space. So you now have a T shape. For some women, especially for women often who've already had children, this is not meant to be as painful. However, that's not always the case. But for many women, the pain can be so severe, the body can go into shock. It can go into uncontrollable shaking. It can cause women to faint, to vomit instantly because the pain is that bad. And the cramping afterwards can be horrific. This is something that is not explained because in the literature, it is described as so simple, so pain-free, that going in for this, nobody is prepared unless they've done research beforehand. I don't think anybody is prepared for how awful it can be. And I actually had mine inserted and removed because the lady, and I'm not blaming this lady, they are very busy, but the lady accidentally inserted the wrong IUD because there are two types, and one of them was not the correct type for me because it causes heavy periods, and I already had heavier periods, so that was a whole issue, and it was so much pain, like so much pain. And one of the reasons why it's not supposed to be painful is because in the initial research of the human body and anatomy, it was believed that women's cervix have no nerve endings. Now, this has been disproved. However, the literature has not changed. So even though we know now that this can be excruciating for some women, we know that there is nerve ending in this place that you're sticking something that shouldn't be there. We haven't changed the literature. We don't offer pain relief that is or should be required. We don't offer gas and air. We don't offer to numb it. Often people are discouraged when they ask. They are made to feel like they are being a baby. Everyone gets on with it. Nobody needs pain, so it's pointless. It would be a waste of money. I can tell you that when I had to have my IUD put back in hospital because of personal things that I had going on internally, and I was given gas and air, it still hurt, really, really hurt, but the difference wasn't comparable to the initial time that I had this inserted, and it makes me so angry and so it makes me so angry that there is options out there and they're just not offered because women are just expected to just get on with it because we always have done, and that's just the way things are, and that's why that's the way it's done. And it's because of this lack of research and this lack of understanding of the women's body. And I still am pro coil. I believe it, and amazing invention. Once it's in, for a lot of women, they might not enjoy it, but for me personally, it's something you don't have to think about. Once it's in, it lasts for many years. It has minimal impact on my body, on my hormones, and so I would still recommend it. It just angers me that we have to make choices, that we can't say yes to this thing that's great, but also have appropriate medical care. So many people are traumatized by this experience, and they don't need to be. There are options for pain relief and pain management, but it's not offered, or it's shunned. And the sad thing is, because it's such a systemic problem, other women also put other women down about it, because it's almost like there's a sense of superiority. You'll often hear some women saying to those who are traumatized or complaining, well, it didn't hurt for me. And okay, yes, that's fine. And I'm glad that it didn't. But it doesn't mean it doesn't hurt for other people. If there was appropriate trials done, there would be an understanding that yes, there's a percentage of people who are completely fine with this procedure, don't need pain relief, and then there is a proportion of people that could be ultimately traumatized for the rest of their lives if we don't give appropriate pain relief and medication and treatment. When we look again at the bigger picture, we are talking about women's problems. In society, people have not really liked to be open and honest and talk about women's bodies, their biological function, periods. For years, only just recently, they show red liquid on period adverts, because it used to be seen as gross or too much, or it was inappropriate. It's a biological thing that 50% of the population have to deal with every month. So it's this attitude that we've had that has also not helped the research into women's health. Period related problems such as endometriosis and other often crippling, life altering illnesses that have long been known to not have enough understanding or research, but is still undiagnosed, misdiagnosed, not taken seriously, takes years and years and years to get a diagnosis. And all of this happens. And then, even often, once it is diagnosed, women are gaslit into believing that their pain isn't that bad, all by people who, a lot of the time, have never experienced a normal period or a period related illness or disease, because the literature isn't there, and it's easier to gaslight than to actually put the funding into doing the research, to seeing how women are actually suffering with these diseases and illnesses. Women statistically, even outside of period related issues and hormone related issues, statistically, it takes doctors longer to diagnose a woman with a disorder than it does men the same disorder, and women are often offered less treatment than a man in terms of pain relief and pain management for the same illness, injury. Women can have babies squeezed out of their vaginas, or have their entire stomach cut open through every layer to have a baby removed, which is a miracle. It's childbirth. But they can be sent home, sometimes with absolutely no pain relief, other time paracetamol. Some providers are better than others, but it is accepted a lot of the time that it is just the way things are. Whereas a man could have a significantly less invasive, painful operation, procedure, and receive much higher standards of pain relief. And part of that will be because it is seen as this is just something that women do, and also because women always have done it. But it doesn't mean, just because we've always endured something, that we can't offer and look into better treatment, better pain management. And another big issue is the hormone issue. women are often told, and this goes again back to the hysteria, women are often told for so many symptoms it must be hormone related, but the research isn't there to even make those statements. So if a man was to go into the doctors with the same set of symptoms as a woman, the man may get told, well, we're going to look into this, we'll run some checks, we'll do some CT scan, we'll do an x-ray, we'll refer you to this person. A woman will be often told, and I have had this myself, it's probably hormone related. Or you might be tired, you might be stressed, here's some antidepressants. And I'm not saying I take antidepressants. I'm not saying there's not a space for antidepressants, but I am saying that when you blame women's problems on needing antidepressants, needing a hormone imbalance, we are going back in history. We are seeing that what happened then still happens now. And it is unconscious, but also there is an awareness of it. And the same goes for periods. When young women and older women go to the doctors regarding period pain, period discomfort, period symptoms, they're made to feel like that is normal, but it is not normal to be in excruciating pain because your periods each month. It is not, sorry, you can hear Barney, it's not normal for your life to be altered every month due to your period, but for so long this has just been the norm. We are told this is just something that you have to deal with, and it isn't, and it shouldn't be, but there isn't enough research. It's all widely known, but little's done because research takes funding and it takes money, and nobody wants to spend money on something that is, we kind of already know. Nobody wants to do a trial about illnesses that we kind of already know about. So we've got treatment there. Maybe it's not the best, but it still works. So why should we do another trial to make sure that it's the highest level of care treatment for women if it's getting by and it's working? And for things like endometriosis, period problems, lots of women's health issues and unknowns, that needs funding too. But no one wants to really pay to research something that women have just been getting on with for such a long time. Because if they've just been getting on with it, they can just carry on getting on with it. And unfortunately, that is just how this issue has snowballed. It started and has just continued because it all comes down, sadly, to money and also the urgency of going ahead with finding answers to stuff. And if we can just allow women to just carry on as is, and it's not really causing any problems, and it's not making much noise, then what's the point in really spending that money and that time? There are some positive changes happening. Like I said, I seen the coil being discussed by Alison Hammond, I believe, on she's a morning TV person in the UK, because she'd had a horrific experience with the coil and she herself couldn't understand why they didn't offer more pain relief. And when she found out that they do, it is available, it does exist, they just don't offer it. She made a lot of noise about it, and they've now the change in the literature, not enough, because unfortunately, although the change in the literature to state that the like higher levels of pain treatment will be given when deemed appropriate, it is still the care provider that needs to deem it appropriate. And like I said, the gaslighting is such a major issue within medical care for women. So I do think that this is something that we need to talk about. I would love for you to all include your medical nightmares, your medical gaslighting, your horror stories, any time when you've been made to feel like you didn't know your own body, or you were not unwell, or the pain wasn't that bad, because sharing our stories really is the only way to make the issue known. I might even do another video, a follow up, or some shorts sharing other people's stories so that we can get them out there, get them talked about. We want change, but in order to have change, we need to ask for it and shout for it. There's a lot going on in the world right now. I'm fully aware of that. And this isn't me stating that this is the only problem. I dislike very much when people say, there's this going on in the world, why are you talking about this? Because that is how the powers that be get us to shut up, because there's always a worse problem, but if we there can be more than one problem. But I'm just going to get down a rant if I carry on that line of thinking. So yeah, please include your comments, questions down below. Any other topics you'd like me to discuss, please like and subscribe as well. It really will help this channel. I understand that I haven't touched on the Black community, on the non-white individuals' treatment in medical care through the years and right now, the LGBTQ plus community and their mistreatment in the medical health department. I see you, I hear you, I know that it exists. I just wanted to keep to one topic today, but I will be discussing more issues. I hope this was okay, and I hope that you're okay, and that is everything for now. Thank you for watching.